Hello and welcome to the first in a series of webinars that IAPB is going to hold on COVID-19 and eye health. I'm Peter Holland. I'm Chief Executive of IAPB, the International Agency for the Prevention of Blindness. And I'm actually delighted to welcome you this morning to this webinar. We've had over 1,000 people registering today from 90 countries, which is fantastic. Many of you are members, and we'd very much like to thank you for your support. We're also delighted that many people have registered who aren't members of IAPB, and we're delighted to welcome you as well. For those who don't know us, IAPB is the overarching alliance for the global eye care sector. We have over 150 member organisations worldwide, drawn from non-governmental organisations, corporate sector, professional bodies, research institutions, and eye care hospitals and institutions. Today, we'll be exploring the World Health Organisation's perspective on the impact of COVID-19 on the eye health sector and on the delivery of eye care. We're really delighted that we're starting today with WHO, because IAPB and the Global Eye Health have worked in partnership with the World Health Organization for over 45 years. That partnership has been critical in significantly reducing the prevalence of vision impairment worldwide. And of course, tackling COVID-19 requires global cooperation. But now more than ever, WHO has a vital role in coordinating the global response, supporting governments and civil society to protect the vulnerable, including those who are blind and have sight loss. So as many of you will know, we've called on world leaders to support WHO's efforts at this critical time. And so I'm particularly delighted to introduce our guest today, Dr. Alarcos Cieza, who's the Unit Head of Sensory Function Disability and Rehabilitation at WHO and oversees WHO's work on vision, hearing, rehabilitation, and disability. And Dr. Silvio Mariotti, who I'm sure many of you know, who's an ophthalmologist and a senior medical officer at WHO. Before I turn to them, just a few housekeeping rules. Firstly, the way we'll structure this webinar is as a question and answer, and I'll be asking questions of Alarcos and Silvio. Those questions have come from our members, so we've had lots of questions asked from our members. I suspect we won't, unfortunately, be able to ask them all, but we'll try to get through as many as possible. There will be an opportunity at various points to ask questions from the audience as you have them. And we'll, if you have any questions for the speakers, please type them into the Q&A box at the bottom of your screen. And we'll turn to them during the webinar. We're live streaming the webinar on Facebook, and we're also recording it. So it will be available on our website in a few days' time. At the end of the webinar, we'll send you a survey for your feedback, and we'll really welcome that. I'd also like to introduce the team who's supporting us. We've got Rachel, who's providing technical support, and Jude will be monitoring the questions and answers, questions from the audience, and who I'll turn to from time to time to ask some of those questions. Finally, as I've mentioned, we're live streaming this on Facebook. So we encourage you to tweet and share your thoughts on social media. So after that introduction, let me launch right in with the first question. And I want to turn to Alarcos first. I wonder if you could just give us an overall, what's the World Health Organization's at the moment, progression and response to COVID-19 around the world. Marcos.
Thank you, Peter. And let me first, before we go to the question, thank IAPB for organizing this webinar. It is fantastic to be with all of you. And now, regarding your questions, what is WHO assessment of the progression and response to COVID-19 around the world? And it is really an important question. It is a question that everyone is asking today to WHO because everyone is extremely concerned. And everyone is aware that we are actually in an unprecedented situation And we are trying to keep going and conducting our lives as with this webinar, but everyone is aware really it is unprecedented and it is very serious. Also because of the number of people who are losing their lives, but also because of the socioeconomic consequences of COVID-19 public health emergency. And in terms of your question, in terms of progression, I'm also aware that this outbreak then exploded and was transmitted very quickly. And for that reason, also WHO very quickly declared a public health pandemic of international concern. And regarding the response, regarding the question that you asked, the response, everyone is also aware that every country is at different stages of this response. And actually also at different stages in terms of the effectiveness or the success of the response. So it's very difficult to really provide an overall answer that satisfied everyone. But what I would like to encourage everyone listening is to really visit our press briefings that are taking place every Monday, Wednesday, and Friday with our experts of emergencies, also with Dr. Tedros, our Director General, because these are the questions that are handled in these briefings. What is the response? What is really the progression of the disease? What I think also is important to the participants to know is that there are many resources in our WHO webpage that are relevant to all of you, because our colleagues are also making really a great effort to provide information for the general public, but also for really international NGOs, for civil society organizations, for also health workers. So you can find a lot of technical advice in terms of essential services, in terms of clinical care, also in terms of ethical considerations in the pandemic. Something also that can be interesting that can that I think for the participants of the webinar can provide a lot of information is the online courses that WHO is providing and to which already thousands of people have enrolled and that you can find in our webpage. So let me stop here now. Thank you. Back to you.
Thank you, Alarcos. And I know the question of where you can find information is one that is really important, and it's one I think we'll return to again during the discussion. But looking perhaps a little bit more widely beyond COVID-19, there's obviously beginning to be discussion about the wider impact of COVID-19, both in terms of its impact on health and on the healthcare system. And I was wondering whether WHO is collecting data on the secondary health effects of COVID-19, I guess particularly in relation to eye care needs, but also much more broadly.
Yeah, thank you. Also an important question, Peter. And our colleagues in emergency are indeed putting forward every day a WHO COVID-19 situation report. In this report, what you can find is the official counts from countries regarding the confirmed COVID-19 cases and the confirmed deaths. In addition, of course, our colleagues are collaborating with institutions from around the world, coordinating and getting inputs in terms of the information that is available. And also a lot is being published in the last weeks and will continue being published in the next weeks. And of course, WHO is taking all this information and all this data very seriously, analyzing and taking it into consideration. In terms of the eye care, the data in terms of eye care needs, we have to recognize that no data is being collected in terms of eye care needs. However, let me emphasize that prior to the pandemic, of already the collection of data in the area of eye care and eye care needs, but also in terms of eye care service, was a challenge. So it is not a surprise that today it continued during the pandemic is a challenge. What we are doing now at WHO and what the team is doing is really having a good planning of what is the data collection strategies and even the data collection platform that can be used to collect that data. That potentially will start then before the situation of COVID-19 ends, or potentially will be after. That is still to be seen. But we are putting really our efforts on planning these data collections structures. And we also need to be aware that once the situation improves, we will also be able to look at things retrospectively that will provide also additional information.
Great, thank you. I'm aware that my speaker may not be very clear to everybody, so I shall try to speak more clearly so people can hear. And obviously there's real concern in the sector about the impact on people who have sight loss and vision impairment, but also more broadly, I wonder if you could, given your own responsibility, I wonder if you could give us a bit more of an assessment about how you see the impact on COVID-19 on people with disabilities.
Yeah. Thank you. Also, an extremely important question that has been coming up and has been really a big concern with us, because what we need to be aware that the emergency of COVID-19 is putting people with disability in a position of extreme vulnerability. And we have provided guidance to make aware to our member states of this situation of vulnerability and put forward recommendations that are also in our webpage, not only for people with disability themselves to take precautions, but also for governments, for service providers, for communities, for institutions. And what we are doing now is, and we are not collecting data in the context of COVID-19 response specifically on disability. But again, what the team is doing is analyzing the existing evidence that has been published and that is being currently published and is coming out over the last weeks and will be continue coming, putting together all this evidence. And what we are also seeing that even if when we talk about people with disability, we are talking of a very, very heterogeneous population. There are certain increased risk that potentially all these people have. The first one is the increased risk of getting the disease, of getting COVID-19. And this is related to the difficulties of implementing preventive strategies, like, for example, keeping physical distance. If you need a personal assistant, that is very difficult, and that is very often in the case of severe vision impairment and blindness. But also for certain people, it is really simple tasks like hand washing. That is also a very important preventive strategy. If you have a mobility issue, then, for example, in the case of a spinal cord injury or in the case of multiple sclerosis, then this will also increase your risk of getting the disease. The second increased risk is the increased risk of developing more severe symptoms if you get the disease. And this is related very much to the underlying health condition to the disability. And we know that this is the case, for example, in conditions like diabetes, like cancer, or like respiratory diseases. And the third increased risk is the risk of poor health outcomes then after during the pandemic or during the COVID-19 situation, because it is very difficult in many situations if you don't have adaptations, appropriate adaptations, to keep certain health behaviors that are important, like eating well, like, for example, physical activity. And we know that, again, without certain environmental facilitators, then people with disabilities have these difficulties. Back to you.
Thank you, Alarcos. And then perhaps turning to the eye care sector, I know that people have been asking about the role of the eye care sector in the current crisis. So I wonder if you could talk a little bit about WHO's views around how the eye care sector contribute to combating the pandemic.
So thank you for the question. I'm very happy that you asked that, because it is really an important point to emphasize. One of the things that WHO has been recommending from the beginning to all countries, what it is necessary for the response of COVID-19 is a whole government approach. And we have also provided guidance of how to put in practice this kind of whole governance approach. And based on that, and also based on the knowledge that the countries have, in most cases, there are in countries COVID-19 action plans that are at the national level or the sub-national level. What it is important to anyone that wants to become active in the response of COVID-19 is first to be aware of what is the action plan at the national or sub-national level in the country where I want to be active. And secondly is to find out the mechanism how to contact the people responsible for this action plan and really start an interaction in order to be part of this coordinated response. What it is not really intended, should not be the case, is that in a situation, an extreme situation of an emergency, then uncoordinated actions happen. So then please always take into consideration the situation of your country, this action plan, and get into in contact with the people responsible for that, and really then plan that whatever you want to do is planned in the context of that action plan.
So, Silvio, perhaps I can now turn to you. Obviously, for many of our members, one of the critical questions has been, how do you continue to provide eye care in the current environment? And obviously, many organisations are facing real challenges. Lockdown restrictions mean they can't or have had to stop delivering many of their services. So again, I wonder if you could talk through WHO's advice on the delivery of eye care services, both routine services, but also looking at critical and urgent care in the current situation.
Thank you, Peter. Yes, indeed. Of course, the situation is a challenge for all health services around. And as you said, many had to be stopped or halted due to the general situation. But eye care in this case doesn't differ from other health services. So the first recommendation is to align to the basic rules that everybody is trying to implement, which is effective practicing of triage, delay non-urgent visit and procedures, and prepare a safe eye care service ecosystem for those who need to be served. Going back to the first one, triage. Triage is the one that we all recommend to avoid that the people with suspected infection may access the facilities where the people are, so protect from spreading infection. When triage is effectively done, and in case of suspicious cases, they need to be referred to the COVID response facilities which have been organized using the plans that Alarcos just mentioned in every single country. Second one is to delay the non-urgent visit or procedures. In this case, what is important, I would like to stress, is not to abandon the patients, but to give feedback, distance advice with online advisory services, telephone, teleconference, social media that we all as professionals might be using in order to avoid that the patient felt left behind or unconsidered. So there are many ways today in which we can still assist our patients, but delay what is not urgent. And then for those urgent cases that need to be examined or served during this time, it's important to prepare a safe ecosystem in our facilities, in our settings, protecting patient and staff. I would like to remember today is the International Labor Day, so workers need to be protected as well. Using the safe surgical procedure that other specialties are also doing, and guidance for this is available from the major professional organization, can be accessed through their website, or can be also access to the International Council of Ophthalmology, World Council of Optometry, and IAPB web pages, where all these are collected, made available, and can be accessed and implemented. So I would say that there is quite a number of guidance available for those who need to be served. But again, I'd like to stress not to forget patients, that they cannot come to our places, to our facilities, hospitals. Doesn't mean that we are away from them. They need not to be left behind. Over to you, Peter.
Thank you. Thanks, Silvio. And looking at a very specific question that has come up, and it is an issue of concern, I guess, probably all over the world, which is access to PPE. What's your advice to eye care organisations at the moment that are seeking to source and use PPE?
Yeah, that's a very hot topic everywhere in the world, because as we all know, there is an acute shortage of certified good quality PPEs. In any case, Alarcos mentioned before the plans that exist at national level. All countries have a registered source for certified PPEs, the one which are proven effective and tested effective for patients and providers, and two are different. We recommend to stick to those sources because using unsafe or unproven PPEs can even prove more dangerous than using no PPE at all. So avoiding as much as possible self-made or uncertain quality distributors for PPE would be the first line of defense. Second one, for ophthalmology in particular, there are some additional protection measures that we require because of the nature of our examination when we need to serve patients. And these are available again on the major professional websites. And they're also available as a simple design and can be simply self-made and put in place on slit lamps, on examination instruments. And of course, the sources I mentioned before, ICO, WCO, IAPB, are good sources for those. And we, of course, can also be contacted to assist in case there is difficulties for accessing those designs. But again, one recommendation, don't ask WHO, we don't have more than others do. And we are working with government to ensure that when services reopen after the climax of the infection, everybody will be able to protect themselves and the patient while serving them. Over to you, Peter.
And I guess the priority must be that PPE must go to people, particularly on the front line at the moment as well. Jude, I can see that we've had a number of questions raised from the audience. Perhaps this is a good moment to turn to you.
Thanks, Peter. Thanks, Silvio and Alarcos so far for some great responses to the questions. Silvio, this one's for you. We have a question from Kemi. What can we expect in patients that have had previous history of COVID-19? What do we need to ask and be concerned about if they've already had it?
Well, I mentioned before you get patient onto your facilities or premises, just practice triage. And triage, and of course there are guidance for these, there are key questions like the common symptoms for COVID-19 disease, exposure or being close to people with then confirmed infection, have been in places where, for example, the facilities, the hospital where then has been reported cases. This is something that people need to ask before even considering having patient coming over. In the case, all this is green light, all is good, and patient coming, we mentioned before, ensure that there is a safe ecosystem in your facility. So PPE is available, disinfection, try to download and print the good practice posters which are available in order to remind patients and yourself what should not be done. Alarcos alluded before to the fact that WHO is actively collecting from member states all what is current knowledge about the disease. As you all know, one of the signs and symptoms often associated with infection is conjunctivitis. So be particularly careful when you see this sign or a patient report this sign before coming on a time of showing up. Of course, walking patients is the most dangerous thing in these days and during the pandemics and should be avoided as much as possible. But I think that, again, we are not different from others. So just ensure that you follow the guidelines line by line and point by point, because that's the best safety for your patient, for yourself, for your staff.
And just to follow up on the bit you said about conjunctivitis, we've had another question as well, just with the evidence, or is anything being done to prove whether conjunctivitis is a route for spreading coronavirus?
What we know, I mean, I can share with you what is known, and we all know because this is commonly known in publication, is that we know that there has been identification of the virus in tears, particularly in active patients with active infection and heavy conjunctivitis. Whether this is a pathway for spreading infection is not yet clear. So we can't say yes or no. This is still speculated, still under investigation. At the moment, we don't have reply from the countries where the infection has been more robustly spreading around. And we're looking for this before saying anything, because it would be just unacceptable for us to speculate or to give false alerts or false safety.
Fair enough. And back to you, Peter, for the next question.
Thanks, Jude, and we'll perhaps come back to you later on for some more questions from the audience. Silvio again. Obviously, a lot of us are now working from home and obviously learning how to do that well. What advice does the WHO have for those working from home, teaching children at home, in relation to protecting eyes from the OP?
Thank you, Peter. Yes, I mean, we are all having an excessive use of screens and of electronic media because of the situation. So this is quite obvious. I mean, in confinement time, where we are doing our best to keep in touch, to keep working. So increasing screen time is accepted, and in children attending remote school and remote teaching is unavoidable. I think that we need to start by remembering that this time is no different from other times. So usual recommendation apply: good illumination of the room where devices are used, strict respect of reading distance, enforcing it, switching on the blue light protection function that many of our devices today have, and allow or enforce the rest time after long screen periods. So the usual 15 minutes or 10 minutes after 40 minutes of uninterrupted use of reading of tablets, computers. One important thing is also that be careful about children who are prescribed to wear spectacles, that they do so. In home time, they may try or be inclined to remove it. Parents need to be recommended to respect the prescription of glasses. Another important thing which relates to the use of tablet or vision, but not directly to it, is to verify that you are using a correct posture while using electronic devices. So the head neck position, shoulder and upper back position to avoid muscle contractions, and also take breaks. For example, after this seminar, we need to take some minutes break in order for our muscles and body to recover from this forced situation. Rules for correct posture, good ergonomic situation and posturing are available, commonly available. in case someone wants to have them. Of course, the eye care program in WHO is happy to provide these as well, the one we are using for ourselves and our own staff, in case you might want it. I would like to take this opportunity also to mention something special about those who wear contact lenses. Long-term screen reading normally reduce the number of blinks, and expose some risk of dry eyes. These, in the longer term, may reduce the comfort in using contact lenses, and also the safety of the same. For this, it's not the right time to have any accident with contact lenses. So respect the normal rules. Contact lenses need to be handled in the safe way you normally do. So the management of them is the same as in normal times. Enforce the rule that you've been told in wearing lenses, and protect your corneal surface, which is a very important barrier for our eyes. So be scrupulous with the maintenance of contact lenses, and this will ensure that you don't run in excessive risks because of the long time we spent in front of computers, screens, and tablets. Over to you, Peter.
Silvio, thank you again. I think that's really helpful advice, I suspect, for all of us. A final question, and a final general question, and you've touched on this a few times, but I think it'd be helpful to ask it directly. Where do you recommend eye care organisations go to get advice on what they should be doing and what to do in the current situation?
Thank you, Peter. Yes, it's important. And again, maybe repeated as a broken record, but first of all, consult what your national authorities, Ministry of Health, or in some places also the WHO country office may have already prepared and made available to the public and to the profession on the web pages. Secondly, be very careful in considering the epidemiology of the situation and the situation in the places where you deliver your eye care services. This is made available through many international media, WHO, CDC, ministries of health. That's commonly available information at the moment. As professionals, we need to use this information. Strictly, very strictly enforce triage. We said it before, we repeated it before, but stays very, very important. And again, eye care personnel are particularly exposed because of patients may need to walk in for emergencies. So we have to be very strict on our protection and protection of patients when they come in our facilities. One thing which also is obvious that mass eye care services for the moment are not allowed even by law in many countries, and are recommended because of the situation. And maybe in the future we need to revisit the way we deliver high volume services, how we organize our facilities to satisfy the maximum number of patients in need of services, also through a risk-benefit balance. Moving forward, Alarcos said it before, the World Report says it, integration in the health system is the way forward in order to serve properly and in high quality our patient. And as I said before, for those who continue providing services to the people in need, which again is a very important and very meritable practice, professional organization, ICO, WCO, IAPB offer all the information available at the moment, and this needs to be the first source of information to ensure that you get the right information to keep practicing a safe and high quality service to your patient. Over to you, Peter.
Thank you very much, Silvio. Alarcos, perhaps I could turn back to you now. Silvio has already begun to allude to the thinking that we will need to do as we in the future, and the impact on eye care services. And obviously, as we begin to emerge from the current crisis, we will want to be starting eye care services up again. But I wonder if you could talk through your thinking around how eye care services are likely to adapt as we begin to emerge from the current crisis.
Okay, so the question is how eye care services will begin to emerge from the current crisis. Good, thank you. Actually, an extremely good questions from the participants, and thank you for asking that. And actually, let me make to the most important point, and actually from my point of view, and also to link this point to the World Report on Vision. And the most significant recommendation of the World Report on Vision is that eye care must be part of the health sector service delivery system and of the health sector strategic plans. And this message of integration was important before COVID-19, it is important during COVID-19, and will continue to be important during COVID-19, after COVID-19. It was important before COVID-19 because, as we have said also in the World Report on Vision, one of the factors what we can assume has contributed to still 1 billion people around the world not having access to the eye care services they need is because eye care services are not part very often of the health sector, integrated, are not part of universal health coverage, and very often are provided in parallel systems. However, integration is also important during the COVID-19 pandemic, because you are part of the service delivery platforms, of the health service delivery platform. When countries plan their strategies how to respond to the pandemic or to a pandemic, of course, you will be included in that discussion. You will be considered in being part of the response, whatever the recommendations are then for you and your sector, but you are part of that planning. And thirdly, it will continue being relevant after the response to COVID or to a pandemic because of sustainability purposes, because we know that for sustainability, integration is fundamental. So integration will continue being a key objective to which the eye care sector should be continue striving for. My second point is, every sector today is learning. And what it is also very evident is that the eye care sector is also learning. We are seeing that in the existing publications that has been coming out over the last weeks, and that there have been strategies that are explored to that are being put in place. For example, Silvio mentioned before triage and really exploration of how is the most effective way of making triage and deciding what are severe cases that need emergency care and immediate care. And there has been, and there are also approaches, for example, through telehealth and telemedicine that has been implemented and are being explored at this time. And actually, telehealth is also being really explored, not only for the sake of triage, but also for continue providing care. And actually, that is also a very good exploration, because as we well know, eye care is also an area where imaging is very important for diagnosis and management of disease. So it can profit a lot from telehealth, and this area is also being explored. But for example, also task sharing. What we are seeing also during the pandemic is that a lot of task sharing among health professionals is taking place, that professionals that were not providing certain services are providing services during the pandemic. So the eye care sector is also learning and implementing. What it is important is to learn in such a way that we can learn after the pandemic what are those approaches that need to be scaled up, and it is an advantage to scale up. So that is the reason why my third point to answer this question is when you explore and really put in practice certain avenues to provide services, make sure that you do it with the rigorosity that is needed in order to be able to provide quality services, of course, that you also document those practices, that you also collect data, that you also do research that can show us that these approaches are effective and cover the need for services with quality and in an effective way. So that, again, at the end, we know what are those approaches that needs to be scaled up. So thank you, back to you.
Thank you, Alarcos, for what was a very comprehensive look at that question. And I think emphasize that last point, capture experience and information around it. We're beginning to publish some of that on our resources page, but I hope this may be work that we can do more jointly together as well over the coming months.
And actually, thank you that you mentioned that, because exactly that was what I wanted to tell you now, that it would be also fantastic and a good initiative from IAPB perspective, really to document and get the experiences from what are these alternative approaches that are being explored during COVID-19, and of course researchers and so on, to promote then the publishing of good publication and quality research. Thank you.
Great. I can see we've had a lot more questions, so perhaps this is a good opportunity to turn back to Jude for a few more questions from the audience. Over to you.
Thanks, Peter, and thanks, Alarcos. I have to concur with the Alarcos and Peter, and please, publish what you can about what you're seeing and finding with the way that the COVID, you're treating it in your clinics or practice or organisations, so that we can come up with, a collective set of answers. So, Alarcos, these questions are for you. The first one that I have comes from Sonal, and they've said within the UK, they've implemented a rapid access triage service for those that present for changes in vision. However, with the long-term impact of social distancing and fear of infection from accessing healthcare services, what public health messages do we need to proactively disseminate to people around existing active eye diseases? And how would WHO recommend we reach those high-risk groups to prevent avoidable sight loss?
Thank you. An extremely important question, and I completely agree. Sometimes, even if you want to really implement effective avenues of how to continue providing services, then the reality shows that there are certain difficulties. How do you overcome that? And I think in terms of communication, we have seen also in this pandemic how important is communication for everything, for communicating with the public, but also for reaching specific populations. And I think there is, in different avenues depending on the setting. But of course, I think if there is assistance of patients' records and so on, it is a possibility, of course, taking care of all requirements that are needed for keeping all personal relevant data, of course, without risking that these remain not disseminated, but that really the health facilities potentially can communicate with the population and with the patients that have been serving over the last years, over the last months. And also, for example, making sure that we disseminate information in a way that it can also reach people who are, for example, older people, that we find the venues. Okay, what are the communication means? And we know that it is very frequently does not work with current technologies like apps, iPhones, and so on. So we need to find those ways where already the information is provided via via a traditional mail, so that people receive letters, because still in most of the places is also one of the essential services that are still maintained. So it is depending on the setting, always try to think, okay, what is the way in which I can reach this population, think what are the venues that still within the essential services that are provided, this information can come to them, to their homes.
Yeah, I think that's very, very wise. Knowing how your audience needs to be reached is, really important. And I guess this one almost follows on, I guess. What do you think is the role of virtual consultations or telemedicine in eye care in the current situation?
And I think, virtual conversation and telehealth, it will not be the response to everything. No? But as I mentioned before, it has a lot of, actually promise a lot of future, a lot of good, or being a good approach for the eye care sector. Again, as I said before, because the dependency of imaging for diagnosis and also for management of diseases is an area of the sector of health that really can benefit a lot from telehealth. So I think, again, it is a time where this should be explored and should be explored, but collecting the appropriate data so that we can really obtain the lessons learned. Where does it work well? What are the populations that I reach? What are the populations that I don't reach? So that, again, when we come out and recover slowly from this crisis, we know, okay, with this population still can be implemented. In this setting, it can be of use, but with this population, I still need to find other venues of communication, of reaching, and I need also to get still the care to these people. How do I do that? So in summary, yes, explore important, collect the data so that we learn, that we have evidence that in which setting we need to scale it up.
Yeah, I think that's really good. And, there is also evidence that you can draw on for where it has worked to date as well. I think there's a guideline on your website and on ours for people to start as a starting point. And one last one from the audience here is, are there, from an advocacy perspective, are there any particular messages we should be highlighting to governments, particularly in the context of developing countries where hygiene or quality or other issues may be a problem?
Yeah, and I think what you have already said, of course, it is one of the things that has been emphasized all the time during the conversation is the issue of triage, identifying severe cases still that really need also continuous care, even in lockdown situations. So if one has glaucoma, so you need to continue doing your care management so that the condition does not progress. So I think the important message is that it is important to put in place those mechanisms so that triage, identification of severe cases, identification of services that need to be continued during these public health interventions are put in place, like lockdowns, so that those that cannot afford not receiving care, and that is essential, continue receiving care also in the context of eye care. And again, looking at ways how this can be also part of the response in my own country or in my own community. So look for what are the plans that has been put in place in the health sector and how you can be part of this response of this planning so that those essential services are provided as much as possible.
So that our messages go with the health messages and other messages that are going out. I'm going to hand back to Peter because I can see the clock is ticking and he's got the last questions. Just keep your microphone close, Peter. I've been told there's some issues with your sound, so please.
Yes, I'm sorry about that, but I hope people can hear me. I have a final couple of questions for you, which is looking very much to the future. And obviously last year, and you've mentioned on this already, last year you published the World Report on Vision, which was a great report. It obviously set out the scale and the urgency of the issue and the framework for tackling it. I wonder if you could just talk about, and these are questions that have been asked from the audience as well, what are the implications of the pandemic for the World Report on Vision and for its implementation?
Good. So the question is, what are the implications of the pandemic of COVID-19 for the World Report on Vision and its implementation? And again, an extremely important question, and I'm very thankful that you asked that. And a lot could be said about that. And the most important message, I would say, is that the recommendations of the World Report on Vision are now more important than ever. I have already spoken about integration and how fundamental integration was before, now, during, and is and will be after the pandemic for sustainability purposes of eye care. But also the recommendation on providing people-centered eye care and really structure and find the mechanisms and the way to work in the health system so that people-centered eye care can be provided. That means, in concrete terms, is that there are a provision of quality eye care services as close as possible to the people who need them and their communities, and so that everyone gets those services that are needed. That is simply people-centered eye care. And as also mentioned before, now there is an opportunity to explore the mechanisms that bring care close to people, that and close to their communities. So we need really to leverage those lessons learned, to collect the evidence so that we know how really we can implement and how can we scale up those mechanisms that work. And because then really, and we see that it is fundamental to have the services close to people and to the communities, because and we see it also that when those services are close to people and the community and are provided through those mechanisms, and we were talking before of telehealth, in those settings where those was already implemented, the services now during the pandemic are less disrupted. So again, it's important to learn of this experience and in which settings certain mechanisms were already in place before, and for that reason, the services are less disrupted now. But the message is very relevant now. So if the services are close to the people, come to the people, close to their community, people can continue receiving the services they need and people-centered. So in terms of the implementation, and IPB know very well, because we have been working very close together with IPB for that, we have certain delays with launches of the report. And I think we have accepted until now that there are certain delays and that we will cope with these delays once, or with these launches once the situation improves. But I think now is coming slowly the time where we also need to explore additional venues and mechanisms, how potentially these launches could take place because we don't know how long actually the response to this pandemic will be with us, and it can still take quite a lot of time. So I think it would be also an invitation to explore further venues, how we could do that, because it is important to disseminate the results of the report and to have those launches. In terms of the technical work that the World Report asks for, we have continued doing this work, and I think that is not disruptive because we can use these communication means, and it is really fantastic. What I would, and we are doing a lot of work, what I would also suggest, because I think it's great to see that there is so much interest for this kind of webinars, we would be very happy as WHO to provide a webinar together with IAPB again in reporting and telling what is this technical work that is taking place. And also one important message, what the World Report has already achieved, and it is a huge achievement, is that these results of the World Report has motivated countries to put forward a resolution at the World Health Assembly, a resolution that asks WHO, but also the eye care community to implement the recommendations of the World Report over the years to come. This resolution will be discussed during the World Health Assembly. The question is still whether it will be now in 3 weeks during the World Health Assembly that will take place in a virtual form, in a reduced form, or it will be in a later time point where there will be an extraordinary then World Health Assembly. That we don't know yet, but what we can be sure is that with this resolution, the mandate will be there for all of us, that ministries of health will show the interest that integrated people-centered care need to be implemented, and the recommendations for the World Report of Vision to achieving that need to be implemented. And this is really very good news also for the eye care community. Back to you, Peter. Thank you.
Thank you very much. Thank you very much indeed, Alarcos. We're unfortunately out of time, and I know there are many other questions that people will ask. We'll try to gather them and perhaps put some of the responses to them on our website as well. And we've also had a message from the Community Eye Health Journal, and they are inviting people to make short articles in response to the question that Alarcos made about gathering information about people's response to the current context. So we'll publish the details about that too if people want to see the article. I'd particularly like to thank Silvio and Alarcos for their contributions this morning. It's been enormously helpful, and it's been great to have you with us. We will very much take you up, Alarcos, on the offer of inviting you back probably very soon. So I'd like to thank you and everyone for attending, and hope to see you again very soon. Thanks very much.
Thank you.
Thank you very much. Goodbye to everybody.